Hi, I'm Bill Cartwright, President of the National Retiree Legislative Network. We're here in Washington, D.C. Monday, Tuesday, and Wednesday of this week to lobby for very important issues affecting seniors and prospective seniors and their grandchildren and children going down the road. Starting with protection of pension benefits as a result of de-risking. De-risking takes away ERISA protections and all protections when companies annuitize the plans, and now hundreds of thousands of people are affected by that today. The second thing we're approaching here is about those Medicare Advantage plans and privatization. Privatization is a terrible thing. It's going to leave our descendants with no health care insurance except to rely exclusively on insurance companies and their high prices as we go forward. The insurance companies today are being paid benefits upwards toward $100 billion a year to privatize, when in fact their cost is much higher than fee-for-service, and no one's telling you that story. So we're out here trying to do that today. The third thing we're working on rather extensively is, of course, Social Security. That should be on your minds. As you know, Congress has been discussing about cutting Social Security benefits, raising ages in terms of the eligibility that you have to meet. We're making our recommendations in that area and asking them to fund properly to reflect the growth and the actual natural aging of this population that's growing to 100 million people over age 65 within the next 20 or 25 years. It's unrealistic from a policy standpoint to be getting rid of those programs at a time when we're going to need them the most. Third, we've been talking about prescription drugs and the effect. Of course, we believe that all drugs that are not branded and not protected by patent should be bid out competitively. We're not sure about this negotiation, whether it's going to work or not, but at least it's a step in the right direction. It should also save you money, and those negotiations are going on now. The government has named 10 specific prescription drug types for consideration. The last two things we're working on, of course, is the Susan Muffley Act for the Delphi retirees who were cheated out of their pension benefits by government interference when the task force in 2006 and beyond negotiated a deal whereby they were excluded from protection and General Motors workers were included, and even the workers in the unions are saying that these management people should be deserving of this correction of going forward. And then there's health care services, health care insurance, HCTC, where the retirees under age 65 do not receive the benefit of that protection until they return age 65 if their plan has been terminated on a distress basis through bankruptcy. So all those things are on the table. We're working hard at them. We ask you to join in at nrln.org and help us with this effort. No matter whether you're age 50 or 35 or 65, all of these things are going to have a tremendous impact not only on our health care and our income security, but on the economic security of our people as they age in this country. It's unavoidable, and somebody has to do something about the policy decisions that are being made now that are very negative relative to that future. Thank you very much for your time, and nrln.org, sign up and help us.